Super wonderful. Welcome everyone to the SGP Gender Cafe today. We're very excited to have so many people zooming in from all over the world. My name is Christy Kelly and I'm one of the members of the startup team for SGP and excited to have you here today. Our topic today is the other pandemic, adapting GBV work during COVID-19. And we're very excited to have team members of COFEM from all over the world joining us today to introduce us to some of their work and to engage in a wonderful conversation. We're hoping for shared resources and opportunities to work together. For those of you who are new to SGP, we are an international organization made up of gender practitioners, academics, as well as activists, working to raise the field of gender expertise around the world and to coordinate feminist action to improve the lives of men and women. Gender cafes are one of our sets of activities. These are regular opportunities where members can present new ideas, resources, tools. We value non-hierarchical sharing, questioning, and learning beyond the classroom in these sessions, and we hope that these are providing great opportunities for professional development and for us to network and get to know each other better. We will be using Zoom today, as you know, and probably many of you are already very familiar with Zoom. We'll start with 3 presentations by COFEM team members who will provide some sparks of ideas and some expertise and resources to think about. And then we will move into smaller breakout rooms for a more engaging discussion. When we get to the point of the breakout room discussion, you will see a little icon on your screen that will say, you are invited to a breakout room. Just click on the blue button, join breakout room, and you'll automatically be taken to a room where you'll have 25 to 30 minutes to talk, and then you'll automatically be brought back to the room. So no need to panic and worry. If you get lost along the way, we're here to help you. So before we begin, we want to kind of lay out some expectations. We hope that everyone who's here today will feel comfortable sharing from your personal experience. We want to think about ways of centering and amplifying the experiences of members with marginalized identities. And we want to create a space for learning. So please, when we're in the breakout rooms, don't just jump to solutions. Let's think about the problems that are out there and how we can speak from our own personal experiences of how we deal with those problems. So very excited now to introduce our co-hosts. First, we have Catherine Nyambura from Nairobi, Kenya. Catherine is an international development expert and consultant on women's rights, global health, and advocacy. She identifies as a Pan-African and pluralist feminist. She has an academic background in public health and has worked on women's rights, adolescent health, policy advocacy, communications, and a whole host of other gender and feminist-related action. We're very excited to have Catherine here sharing some of her experiences working with COFEM on the topic today. We also have Tina Musuya from Kampala, Uganda. She's a social development feminist and with expertise in gender issues, violence against women programming in the sub-Saharan region, and holds an MA in sociology from Makerere University. She's currently executive director of COVIP, a leading Ugandan violence against women and girls prevention organization known for its groundbreaking SASA work on community mobilization to prevent violence against women and girls. Unfortunately, Tina's been having a little bit of technology problems today, so if she's not here during her presentation, we have Leah Goldman, who also has been working with Tina and is an SGP member, who will present her slides for her. Third, we have Micah Williams, who's zooming in from Stockholm, Sweden. She is a gender-based violence specialist, primarily focused on gender-based violence in humanitarian contexts. Since 2010, she's served as International MediCorps Senior Gender-Based Violence Advisor and Technical Lead, supporting design and delivery of gender-based violence prevention and response programs in over 25 countries around the world. She has her master's in international relations, focused on gender, human rights, and development, and a master's certificate in international conflict resolution. We're very excited to have all 3 of our presenters today, and thank you all for sharing your time and expertise with us. And now I will turn it over to Catherine to get us started.
Thank you so much, Christy, for the introduction. Thanks, everybody. Welcome. Good morning, good afternoon, good evening, good night. from across the globe. I'm excited to kick us off on this webinar, and I will be speaking more from a conceptual framework where I'm just mentioning that it's important for us to maintain a feminist analysis and framing and power approach on GBV and violence against women prevention work as COVID-19 unfolds. And why is that? As feminist activists, as those of us who work on gender equality on a normal day, well, quote unquote normal day when there's no COVID, I don't know if many of us remember what that day looks like. Problems and revelations we are seeing now are not new. So we know that in many crises, our risk of gender inequality and exposure to violence grows. One, due to reinforcement of unequal power dynamics, instability financially and at home, broken down social and protective frameworks, and lack of services and more. So just to explain and go deeper into what this means, is that even though in the recent weeks we have had violence against women being declared as a shadow pandemic, including by the Secretary General and UN Women amongst other actors, it's coming up as a critique and a weak point. Yet for most people who've been working on feminist organizing and activism, this really is quote unquote old news. Feminists have been ringing a bell about the endemic nature and the global scale of violence against women for quite a long time. And so there is need for us to ensure that the focus is more on structural inequality of the system, and GBV as an example of the limited efficacy of traditional gender equality and women's empowerment approaches. And also just to mention that the refusal to integrate feminist analysis, or rather downplay it or not integrate it fully, reveals how some of the work that's being done on gender in itself is not structural, or it is not necessarily taking up the power analysis that feminists have been pushing for a long time. So we should shift to an approach that's guided by the need to affect structural change. We have also seen that a lot of feminist work in many instances does sit across and parallel from what gets adopted as public policy or mainstream government interventions. So the crisis makes, and the COVID-19 crisis makes an argument for the necessary and necessity for a more radical feminist approach to take up on the structure of our governments and systems, and not merely poor anti-women policies as we've seen across the globe. So we have seen the reinforcement of gender inequality on aspects of mobility. Women already have limited mobility. In some cases, women have to ask permission to travel. There is control and infringement of women and girls' fundamental freedoms. It's even in protracted crisis, but also we know it exists in normalized way in societies where there's no crisis, and such as women cannot share public spaces equally, right? Because, or they cannot share public spaces after a certain time. And so it's important for us to remember what violence looks like and what it looks like in a crisis and how it gets amplified and deepened at this time. And just to move us forward, it's important to also realize that some of the drivers and root causes are getting that are getting deepened, and that is leading to the rise, as we are seeing of GBV and the different kinds. I think most of us are quite familiar on the different kinds of GBV that are being reported. There is intimate partner violence, there is structural violence, there is institutional violence. We have seen cases of police brutality, including against women. We've seen reports of rape during enforcement of curfew and lockdown measures. And I could go on in terms of listing, but it's important for us to, nuance the forms of violence and women are facing, harmful practices, to name a few. And so social norms reinforced and patriarchal status quo kicks in, which justifies decision-making that's exclusionary. I know there are many spaces where women are critiquing the lack of representation in quote-unquote committees that are driving different aspects of the response. The decisions that have been made, for example, initially, I am from Kenya, so we had curfew, we have curfew, and we have different parts of the country's lockdown. And so in the first few weeks, we did have a rise in maternal deaths because women could not access necessary healthcare. Women could not go to hospital to deliver, and that in itself can really create a spotlight and shine a light on the blind spots that end up happening. Even during lockdowns, we've seen patriarchal structures consolidate power. We've seen across the globe, we've seen countries enforce or introduce homophobic laws, transphobic laws. We've seen countries revisit bills, even though parliaments are not meeting as usual, but when they do meet, the priority, for example, becomes introducing measures to, or, attacking or arresting LGBT people. We've seen that in Uganda, we've seen it in Hungary and many other places. And recently the SG did put out, a call for just calling on states to not use the pandemic as an excuse to violate human rights. And so the gendered nature of structural and institutional violence has been documented. As I've mentioned, we've seen racism become magnified, ableism, homophobia, transphobia, and for HIV-related stigma. I think for me, this is an area where I'm working on right now. We've had adolescent girls and young women being forced to disclose their status. We have had limited mobility, especially for adolescents who might, in contexts where there's no COVID, already need parental consent. That is being reinforced, so parental consent, spousal consent, and we've seen economic instigated violence amongst others. So it's important for us to just reflect on the nature of what violence looks like and how we can maintain a strong power analysis as we continue as COVID-19 unfolds. And just to wrap up, I think it's important for us to expand and have an intersectional approach. So we've seen many countries shift health resources to address COVID-19 in what will be an effort to an urgency to prioritize or rearrange resources. Often that means money is taken from what is deemed quote unquote, non-essential services. And so we have seen broken down across the globe supply chains for SRHR commodities, HIV commodities, and this has led to shortages. And I think it's important for us to see how we should keep, while we do GBV work, while we respond to the pandemic, we do not reinforce or entrench other already existing challenges in our communities, like teenage pregnancies, lack of access to contraception. So we've seen user fees increase because there's a shortage of commodities. We have seen a lot of, personally, the adolescent girls I work with, your support, WHO recommends a 90-day supply of ARVs, and most of them are only able to get up to 30. And that means they do have to, if they wanted to stay home and not expose themselves by going to public health facilities where most of them are already worried with not enough information as to what the risk factors look like for those living positively. It means that we are not necessarily applying a lens from a point of thinking of multiple intersecting identities, vulnerabilities, and risk while thinking of our response. And I think I want to wrap up on accountability and solidarity with those most affected. And it's important for us to keep a rights-based approach and accountability to those most affected. Just because we are in a pandemic does not mean our commitment to guarantee sexual reproductive rights, have human rights-based approach to HIV prevention, care, and treatment, have ensure strong gender-responsive public health systems. That commitment by our government is not exempt just at this time because of the pandemic. So it's important for us to also ensure we are pushing our governments to be accountable to women and girls, even as we respond to the pandemic. And finally, is just to think of where does this responsibility come from? It includes allocating resources. We do have contexts where there's benchmarks for this. In Africa, we do have the percentages that governments have been compelled to allocate to health budgets, 15% according to some policy documents like the Abuja Declaration, 10% reproductive health care, according to Maputo Protocol. So these benchmarks will be really helpful in terms of us holding our governments accountable, but also pushing for agenda-responsive budgeting to COVID-19 responses. So for me, just to start us off by saying that as we respond, as we experience this moment of challenge this moment of crisis for humanity, we do have to ensure we do not replicate deeply patriarchal exclusionary systems. Thank you, everybody, and I look forward to engaging throughout the webinar. Over to you, Christy. Is Tina already joining us?
Hi, I don't think that Tina has made it into the room, so we'll turn it over to Leah if you don't mind helping to present Tina's slides. Thank you.
Sure. Hi, everyone. Unfortunately, I can't replace the amazing Tina Masuya, but I will do my best to deliver the information that she has for her slides. And this information is drawn from great work from Raising Voices on how to adapt violence against women prevention programming specifically during COVID. So starting off with some considerations and challenges that we have for prevention programming. Some questions to think about are VAWG-specific services open and accessible for women experiencing violence? So it's unsafe to open conversations about violence if there aren't existing services for survivors and for women who disclose that they are currently experiencing violence. So we need to be careful and ensure that women have access to some sort of resources before engaging in those conversations. It's also important to consider what legal restrictions have been placed on public gatherings and movement. This means abiding by the directives or guidelines announced by your government, as well as still maintaining social distancing to reduce the spread of the virus and keep the public as safe as possible. So even if I know governments have different responses and approaches to COVID right now, but it's important to ensure that any type of prevention work that you're doing is maintaining safe distancing and keeping, everyone safe. So the next question is, does programming increase the risk of COVID transmission? So like I already said, if there's no formal directives that have been declared by the government, if there are cases nearby or within the communities that you're working in, it's important to practice social distancing, which means maintaining at least 2 meters in distance at all times. And then another consideration is, can community members prioritize and continue to engage in planned activities? So you need to, it's important to discuss with staff and activists how COVID-related factors, which include additional household and family care responsibilities, other emergency meetings, emotional stress, how that can impact the community and the time that they have available for programming, as well as their ability to access public transport if required. So those are some basic considerations to run through when you're working through your VAWG prevention programming during COVID. Next slide, please, Christy. So here we have a list of considerations and creative problem solving for VAWG programming, VAWG prevention programming during COVID after you've run through kind of this risk assessment that I mentioned on the previous slide. So when it's safe to do so, you can continue with prevention programming. It's possible to continue with extra care and caution or to move forward with some adjustments, depending on the stage of the pandemic in your communities. Now more than ever, it's important to use positive and aspirational materials, includes information about referrals and support services, and avoid highly sensitive or provocative content. We know that the rates of IPV and domestic violence are shooting up right now, hence the conversation we're having. So be careful about what type of conversations you're engaging with, and be sure to promote aspirational and benefits-based of mutual care and respect during these times. So it's also important to update referral directories. Right now, a lot of services, may not be available. They may have different hours. They may be housed in new places. So you need to learn what phone-based and physical services will be available during the crisis and update the referral list accordingly. You can also do direct outreach to women at high risk by mobilizing organizational networks to check in with women who are known to be in violent relationships or have specific risks, either by phone or in person, while practicing your social distancing, of course. You can also create virtual groups for activists, women's coalitions, and others participating in your program, and share information about COVID, discuss creative strategies for self-care, and identify needs that are arising within the community, and share messages of solidarity and hope. Speaking of, you can also encourage more public acts of solidarity. For instance, as most community members will be in and near their homes, you might consider lighting a candle each evening or hanging a handkerchief on your door to encourage nonviolence and the protection of women and girls in your communities. You can also inspire family activism. Now, we know this needs to also be done really carefully, considering, as mentioned, the risk of increased violence, but if it's safe, you can distribute copies of some of your program materials that foster discussions or personal reflections on issues critical to VAWG prevention within families. This means choosing positive, simple images and content that are uplifting and focus on positive family dynamics, such as mutual respect, care, intimacy, and support. You can also use mass media channels and consider whether it's feasible to shift community-based programming to a media format. You can engage in social media activism, which can be a powerful tool for deepening analysis of gender-based power inequality as the root cause of violence against women, which I think we've seen a lot more of lately, which is great to keep that momentum going. And then lastly, advocate for appropriate government responses that prioritize women's safety. If your organization has an advocacy program or is part of a feminist coalition, you can develop a joint statement that demanding that the government's response to COVID prioritizes women and girls' rights and needs during the pandemic. And I think we've seen a couple of great examples and are happy to share some more resources of what that looks like. Next, I think I'm running low on time. So lastly, just keeping in mind a broader understanding of what accountability means for women and girls with or without a global pandemic. So accountability is critical for ethical and effective GBV programming and securing women and girls' full equal rights. This means promoting women and girls' leadership and decision-making, listening to, learning from, and acting on diverse women and girls' voices and experiences, as well as other marginalized identities that, such as those in the LGBTQI spectrum, recognizing existing gender hierarchy, working at all levels, so the individual, community, societal, and structural, prioritizing the do no harm principle, and ensuring the involvement of men and boys does not disempower or sideline women and girls, but that they're working together as equals and under the leadership of what women and girls need most. And also examining funding decisions, because you can't talk about power issues without talking about money. And over to Micah, I think.
Hi, everyone. Thank you for inviting me to participate today. I'm going to try and build off the presentations by Catherine and Leah. And I don't have slides with a lot of notes here. So I've just included a quote from one of my colleagues, Christiana, who manages IMC's GBV program in Northern Nigeria. And what I want to talk about is the response side of service provision in the COVID context and meeting the challenges of trying to apply our principles in this particular context and specifically in humanitarian settings. So I've shared this quote today because I think that it highlights some of the challenges we're seeing so far in humanitarian settings that I want to talk a little bit about. But just first to give you some idea of the Nigeria program, I know we have some on the line in Nigeria right now. So IMC's GBV program in Nigeria is in the north, in Borno State, in an area that was already considered a humanitarian emergency, so active conflict and displacement. And we have a great GBV program there, I think, one of our better programs. And the team did a lot of really early work to prepare for the COVID response, including looking at how survivor services could be adapted and continued throughout all stages of the emergency. So that involved, a lot of consultations and then a lot of individual client meetings with survivors of all of the open cases within the program. And with those survivors, the caseworkers developed adapted plans, including safety plans, what that would look like if they're locked at home with their abusers, etc. And also asking them about remote service options. So ultimately, a lot of the survivors within open cases in our program did agree to shift to remote services. And just briefly, if people aren't familiar with some of the approaches that we're using right now to deliver client services for response, it's largely still doing the in-person services. So case management, psychosocial support, one-on-one in person with a provider, and having to adapt that still so that it's safer in the COVID context, the distancing, the PC measures. And then the second model is remote service provision, which usually means just telephone-based conversations between a relationship usually is already there. So it's with the survivor and a caseworker ongoing, but over the phone now. And then also, people have probably seen a lot of attention around hotlines, kind of introducing these new open access lines, like a crisis line. And there are different considerations and challenges with these different models, but in Nigeria, we have done both the in-person, continuing the in-person services, and then also remote services through the COVID emergency. And this quote comes from when in Nigeria, the Maiduguri went to final complete lockdown for a bit. And at that time, the survivors who were accessing the remote services stopped calling. And I saw that someone asked actually in the chat earlier about how we reach survivors who we think are at risk when they're locked at home with their abusers. I mean, the really challenging fact is that we can't call them, we can't visit their home unless we think that someone's in imminent risk. And that service really relies on the survivor contacting us, and that's for their safety and for the caseworker's safety. So the remote services rely on this client-initiated call, and what we found was that once the lockdown started, people just stopped being able to call. A lot of times the phone is shared with their husband, and once their husband can't go out of the house at all, they don't have an opportunity to make that call. So it's been a really difficult time for caseworkers there. And I'll come back to that, but I just want to speak then more broadly about these challenges, because I think firstly, something that I find important to keep emphasizing with my colleagues not in GBV and others I speak with is that the emergency related to women and girls starts before we see the infections and the deaths. And it's counterintuitive for, I think, a lot of people that these so-called protective measures are really what's putting women and girls at risk. It's the limitations, of course, on mobility and the difficulties they have in accessing those in-person opportunities. And at the same time, of course, then being more confined at home where stress is increased, etc. And then the second thing that I hope the quote highlights is just the challenge that we see around how we understand service data. And what I've seen in a lot of the advocacy related to gender-based violence in COVID is that some reporting on the increased violence based on service statistics in high resource in some developing contexts. And that's mostly police reporting and hotline reporting. And what we're actually seeing in humanitarian contexts is that the reporting isn't increasing, it's decreasing. And I think we need to reflect on that, because I do believe that both of those trends are telling the same story, but that's a complicated story to tell if we're not careful about it. And I think if people haven't seen, IRC released a press release on May 7th highlighting this trend within humanitarian context, and I think it's really important to reflect on that. It's what we've seen as well within IMC. So going back to Nigeria just for a minute, this quote was pulled from Maiduguri, but in the same region, there are other towns that are not under complete lockdown. So in Maiduguri, we've continued with the remote services, and then also, even during the lockdown in the city, people are able to move 2 days a week for shopping. So we've kept the women and girls safe spaces open those days so that women can access them for one-on-one consultations sort of discreetly during their shopping outings. But even with that, even with the remote services and the women and girls safe spaces open twice a week, what we saw that same week that IRC released the report, so in early May, in Maiduguri, where we have 13 women and girls safe spaces, we had only 3 women report incidents that week. And then in Damboa, which has, in the same region, but where they've instituted some quarantine measures, but not complete lockdown, we only have 3 women and girls safe spaces. And we had 12 survivors reporting that week. So just to highlight, I mean, I don't know how this trend holds, but it's quite concerning that we have a quarter of the service points and we see more than 3 times the reporting in a place that's not on complete lockdown. I have no idea where I am with time, but maybe just quickly that this relates not only, of course, to opportunities for survivors to seek important care and support, but also that within humanitarian contexts, we really rely on in-person meetings to build the solidarity between women, to organize for empowerment opportunities, psychosocial support, to meet with women's associations, to make sure that women and girls are actually heard and that they receive information. And all of that, all of our usual methods for learning from women, helping women to collectively raise their voices and draw attention to their needs, all of those methods are really challenged in a context where we can't gather. And I think we're going to have, I think, some opportunities to discuss those challenges in breakout rooms. But I think maybe just a final point that I want to make is that while we're advocating for women and girls to be the decision makers, to have their voices heard, and also for those services to remain open, we also have this need to respect the rights and risks that the staff face who are providing those services and the women and girls on the front line. And there's sometimes a tension there that I think demands a lot of reflection, since all of the staff and all of the activists have different levels of personal risk and different thresholds of concern themselves. So I think I can stop there and go to the next slide. So we're going to have the opportunity to break out into smaller discussions. And I think we have a number of volunteers who will be participating in those discussions, helping to lead us. And we've agreed on a few guiding questions, just 3 guiding questions to discuss. I'll read them and we'll have the opportunity, I think, in those smaller groups to decide which questions we might choose to focus on first. But the questions are: number 1, what are some of the most practical ways in which you have seen actors leading the response integrate a feminist analysis? Number 2, what are the opportunities for women and girls to lead and influence policy and programming during COVID-19? And number 3, what new approaches, and that includes both technological and non-technological approaches, are you trying to promote? What approaches are you using or trying out to promote connectivity, solidarity, and psychosocial support during the response?
Wonderful. Thank you so much to all of you who've presented today. And again, our apologies for Tina not being here. She's such a powerhouse and we hope that we have her back for a future event. We now have about 7 breakout rooms ready. And so you will be receiving on your screen a little note to go to the breakout room, and then we'll bring you back in about 20-25 minutes or so to close out the session today. Thank you. Hi, Lynn. Sorry, we're supposed to be in breakout rooms now, but there was a little Zoom technical issue, so we'll get you settled in a second.
Oh, okay, great. Yeah, I got bumped off for some reason.
Me too. I know.
Oh, you did too. Okay.
Hopefully
All right,
not
good.
everybody did. We'll see.
Okay, great. All right, thanks. I thought this might have been the breakout
No,
rooms.
I'm
Okay.
sorry. If something happened, I don't know what.
Okay, no worries. I'll wait till. No worries.
Sorry about that.
Oh, I was muted.
You were muted.
So I can't. I don't have the option of making you a host.
Okay, you have the option of you can.
I'm
Oh,
only
because
a
you're
co-host.
co-hosting. Yeah, you're only co-hosting. Yeah.
Can you tell
I
me?
see. So I think what happened was because Leah was the host and then she disappeared to a breakout room, which is what I was worried was going to happen. Then somehow or other we lost everything.
Can we have Leah back for a minute? Do you think?
Let's see.
Unless we have, but even how could we have people back? So we need Leah.
I don't know if she's been knocked out. We might have lost everybody.
Yeah, because we're admitting more people.
You're able to admit. So can you help? Can you make me a co-host and I can help you admit? It looks like we've got. Welcome, folks. Sorry about the Zoom snafu. I don't know what happened. Yeah.
Do you want to lead the discussion here, Christy, until we have Leah's back, maybe?
Sure.
I think.
Are we in a, I can't, can you, are you able to make me a co-host at least from
No.
your space?
No.
No, that's so
But the
strange.
questions are already in the chat, so.
The chat disappeared as soon as someone leaves a breakout room. They come back and there's no chat available to them anymore, unfortunately.
Okay.
But I can pull up from the screen of our PowerPoints. Okay, well, let's, we'll start from scratch. Sorry, everybody, for the problem with the Zoom today. It is not our best friend always, although it is kind of unusual. We usually have found Zoom to be very, very helpful for running these kinds of sessions. So let me put into the chat message here our first question for today. What are some of the most practical ways in which you've seen actors leading the response to integrate a feminist analysis into their work? So I think we have Lynn, Giselle, Fatima, and someone from ActionAid. So you're welcome to open your microphones and we can start sharing information, and I'll take some notes so that we can share with the larger group when we come back. Oh. Well.
Looks like they left. Everybody left.
Yeah. I think we have Leah trying to make it back to the main room. Yeah. I think the problem is that Zoom just only allows one person to host and it doesn't allow a secondary host. So we just need her to come back in to the main room and give us those hosting privileges again.
So Lynn, where you are from? And
I'm based in Los Angeles, California.
Great.
Yeah.
Excellent. And do you work on something related to the topic today?
Yeah, I have a couple things I'm doing. I'm an independent consultant. The most urgent thing for me right now is I'm a board member for a civil society organization in rural Nigeria. And I've been supporting the executive director, who's a young woman. And this past week, there have been 4 cases that are brought to her organization of sexual violence against girls ages 5 to 12.
Oh my gosh.
And it's just been horrible. And she and all her staff have been in lockdown, but they've been really just doing her Herculean effort to provide support to these girls, from health to legal to judicial, the whole 9 yards. And so I'm seeing it, WhatsApp every morning when I get up. There's just tons of WhatsApp messages about the situation and what's happening. 2 of the girls now are gravely ill. Because they're so young. And then there was a gang rape last night. And the guys took pictures, 8 men took pictures so that the girl wouldn't report, but she did, thank goodness. So action's being taken. So yeah, I'm seeing it every day firsthand, what's happening. And this organization has been around for 13 years. I've been supporting them for almost all of that time, and in different ways. And I've never seen anything like this. I mean, it's yeah. Yeah, so I wanted to come here and have this discussion to see what others were doing, and what approaches and strategies others are using to address this increase, both from a prevention and a response. So that was something that I had commented on a couple of days ago. It's great that this organization is doing so much work with response. It's so much needed, but what can we be doing around prevention as well?
Yeah.
And to get the word out there that these are essential services and these are frontline workers. And how do we message that, and how do we emphasize that? Because every time she goes to the family, she or her staff, they put themselves at risk. She's traveling at night in Nigeria, which is extremely unsafe.
Yeah.
Anyway, that's why I'm here.
Yeah. So what are the kinds of things that other organizations in Nigeria are doing? I mean, assume they're all in the same situation, without much funding, without much support.
Well, yeah, I mean, I don't think it's just Nigeria. I think it's globally. I mean, what I'm seeing is this is happening globally, and we know that these organizations, no matter where it's based, whether it's in rural Nigeria or the United States, don't have much funding. And then, like the second presenter said, resources are being state resources, and I'm seeing that here and in California and LA County and in LA City, resources are being redirected to health, which I understand, but there are larger impacts for the disease than just health. There's economic, and then of course there's and there's also economic violence, which is a form of GBV. So it's like it's also intertwined.
Yeah.
So unfortunately, I didn't come here with answers. I came here with questions. Yeah, and then I also work at on gender-based violence at a more global level, mostly with USAID projects. What have you guys seen in terms of solutions or approaches that are being used I mean, I think the last presenter was really great talking about some of the remote solutions.
Yeah. This is not my area of expertise. I really came to help facilitate the technology side, so I'm afraid I would do more harm speaking than just listening today, quite frankly. I've been watching a lot of local news programming around the world to see what's been going on, and it does seem like the media is trying to create awareness around this, but it ends up being just a blip in the larger, it's not getting into the conversations about how do we make this a first important issue. You're absolutely right, Lynn, with it being like, let's worry about the frontline workers, let's worry about PPE, let's worry about the people dying, as opposed to thinking about the long-term impacts of what's happening.
Right. Well, and everybody, I mean, it's like any crisis, and I'm not faulting anybody, but everybody has an agenda, right? So there's people that are also, there's lots of stuff around food insecurity, which is also a real need.
Mm-hmm.
So, you know, thinking from the perspective of governments, local or otherwise, how are they supposed to prioritize when they're in the midst of a crisis and
right.
a public health crisis, and that's also turning into an economic crisis, now food security crisis, and there's also gender-based violence. So
Mm-hmm.
what can we do to facilitate and help them and not just be part of the noise around this is important and this is important, this education crisis? I mean,
yeah. Oh, absolutely.
It's multifaceted.
And they're all gender equality crises, right? I mean,
Well, true.
The food issue is because of the supply chain system that we have set up, which privileges particular contexts of the world and particular workers. Women are most often responsible for providing food and managing food. And so if they're not doing their job well, right, that increases their risk of violence all along the way, in addition to securing food, preparing for it, distributing it. Those are all increasing their risk of violence.
And we're seeing it here in LA around the Latino community, because that's the majority of the population here. Mm-hmm. And they're the ones that are still working and on the front lines, whether they're male or female, and gardeners and women, you know, still doing a lot of the care services. They're on the front lines.
Exactly. I work in the education field, so we see a lot of teachers whose job in the past was to kind of keep an eye out for families that were having conflict and violence at home. And interestingly, police officers, as well as they're patrolling streets and areas where we live, rely on teachers to help them identify what's going on. And because the police officers are no longer able to contact teachers because teachers are working from home, that whole chain of communication has broken down. And so police officers themselves have said they don't know what's going on. They're not able to intervene. They're not able to document. They're not able to intervene in prevention. So it really raises, it illuminates how interconnected the systems that we have put in place to prevent, manage, and help people recover from gender-based violence are reliant on healthcare systems, police and security, public safety, school systems, right? After school programs, religious communities. It's not ever a one entry point. And so thinking about how this pandemic illuminates the tensions, when any one of those breaks down, they all break down, right?
Yeah, well said. I like the way you put that.
Yeah. I'm getting a text message from Leah about when to close the room. So I'm going to suggest maybe 2 to 3, 4 minutes. And she might.
And she needs to come back on time so that she lets others back as well.
Yeah. This is really a problem with Zoom. Yeah. So Lynn, how did you hear about this event?
Through, I don't know, the newsletter, I think.
So you're a member of SGP then, yeah?
Yeah.
Great.
Yeah.
Yeah. I think, what are you seeing in terms of USAID or other donor recognition of the problem or the interconnectedness of things in this moment in time?
I think they're completely overwhelmed. I mean, USAID, in the country level, I mean, I think everybody knows they're, Americans are sent home, many of them, and then the nationals are all at home in various versions of lockdown or stay-at-home orders, and they're trying to adjust to that because they're not used to working that way, and then just the demands of responding to COVID in their countries, and and all the ramifications of that, plus dealing with it in their own lives. So I think they're completely overwhelmed. I'm not really seeing, the UN seems to be on it. UNFPA seems to be at least creating a lot. Someone,
I just wanted to ask Christy to send Leah back to the
I did. Yeah, she should be going back to room 7 now.
Sorry for interrupting.
Sorry, technology. Yeah, so I think that is the other, I think, piece, Lynn, that you point out is that this is not, it's not a national local response. Everything that we have set in place for years to address gender-based violence, from whether it's data collection, research, media campaigns, interventions, making sure that a gender perspective is at all level of policy making, is again one piece of that breaking down. And as simple as donors' staff are not working in their offices, right? They've been brought home. That automatically leaves so much of the vulnerability out there. It just exacerbates.
Yeah.
Not just on this issue, on all issues, but this really illuminates it.
Yeah, and also I think, you know, where violence wasn't happening, it's happening now. In you know, we saw in China the increase of divorces after the shutdown, the lockdown, or whatever they called it, their stay-at-home order. But here, even, I mean, it's just like any crisis, I think, that where there were any kind of tensions, you know, violence can increase, even in places where it wasn't chronic. In relationships or in families where it wasn't chronic, now it's becoming.
Yes, exactly.
Chronic.
And where it was, you know, on managed in a sense, it's emerging, and I think that's and re-emerging in new ways.
Yeah, that's a good point too.
I think that's really part of the scary thing, and the fact that if people haven't learned what it is and what it looks like, then they don't know how to recognize it when it's happening, whether they're the perpetrator or the victim.
That's a good point. I think that's a nice, a possible solution in terms of messaging, is increasing awareness about what it looks like in a non-jargony way, you know, and without, in a non-accusatory way, saying, hey, you know, just so you're aware, and given the circumstances, keep an eye out for these signs.
And I think for a lot of parents who don't think of themselves as abusive, there's some possibilities here of becoming. I think this is, I see this again among teachers groups that I work with. They're quite surprised at the kind of what they call the Zoom bombing of parents in their one-on-one remote learning spaces, where the parents take out their frustrations on the teachers that they normally, you know, and so the teachers worry that those frustrations are, without the teacher present, being taken out on their children for the stresses around schooling.
Wow. Looks like people are coming back.
Yeah.
Thank you for the conversation. I enjoyed it.
I'm sorry we weren't able to get you into a room to learn.
It's fine. This was great. Loved talking with you. Thanks.
Yeah. Thanks. Welcome everyone back to the main room. We're just going to give a minute or so for people to close out their breakout sessions. And I apologize, we probably have lost a few people along the way, but hopefully we get everybody back. And just as a reminder to those of you coming into the room, we have recorded the main session, and we have also, we'll be sharing the recording as well as the PowerPoint links with everyone who registered, whether or not they were able to attend or not. I'm just going to go to sharing my screen again while we have people jumping back into the room.
Christy, we had a question in our group about the opportunities for people to continue conversations after this, and I don't know if there's an opportunity for people to connect or share information.
Absolutely. Leah, how do you recommend the best way? We could add a question to the, everyone at the end of this session will be getting a survey where you can provide us feedback, and also an opportunity to let us know if you want to connect again, and we can share that information with our COFEM host today, and then maybe we can work with you to figure out next steps and how to do that. Would that make sense as an option?
Yeah, I think that sounds good.
At least for a first step, some thumbs going up. That's good. Leah, did you want to jump in and suggest anything as well?
I was just going to say also, you know, SGP is here to also provide like Zoom access. Like we can host folks to speak more about this topic within our Zoom room. So we're open to sharing our account and resources as best as we can. So once that survey goes out, we're happy to work with everyone to schedule maybe a couple of different times to reach different time zones and set up the meeting for those.
That would be great. We also have, you can also reach out to our COFEM presenters today directly if you had specific questions, or you had more, you were wanted to share resources or hear more about what they're doing in different contexts of the world. So here's their information. You can either reach COFEM directly or Catherine or Tina or Micah individually. We also have some contact information for you for SGP. You can email us at any time and we'll help put you in contact with people. And you can join the organization. We are a very reasonable fee-based organization. You pay kind of the equivalent of eating out and breakfast in your community. So it's really nominal, but that allows you access to all of our resources within the organization. This one is open to anybody, of course, but we do have other resources. You can check out the website and see what's available. And like I mentioned, we will be sending out a follow-up email to everybody who registered. So whether or not people were able to attend today or not, everyone will get the email. We'll include a link to the recording as well as the PowerPoints so that you have all the information directly. And we look forward to more conversations. I think that while I didn't get to be in any of the breakout rooms for very long, the conversation sounded rich and very, very productive, and that we could have gone on much, much longer. So I want to thank especially our amazing presenters today, and for Hayat for pulling this session together along with Leah from the SGP team. We will end there. If anyone would like to put any farewell messages or final thoughts or resources into the chat box, we'll also collect those before ending the session today and include those in a resource page that will go out to people, assuming we have resources to share at that point. Thank you.
And if anyone also has ideas for your own gender cafes during this time to structure, it can, you know, we like to be creative, and all of these gender cafes are member-led and initiated, and we just really help provide the space and technical assistance in the background. So if you also have other ideas for hosting one, please do email us.
Super. Thank you, everyone. It's been very fruitful conversation.
Thank you.